Nepal is a spectacular country of about 30 million people. I'm here in Kathmandu where we are conducting a large research study involving traffic police who stand in traffic and breathe extraordinary levels of air pollution. Nearly 7 million people a year die early as a result of their exposure to air pollution. Air pollution is endemic across the planet, and nowhere is it worse than places like Kathmandu, Nepal. Most of our understanding of human health research is based on Western studies in North America and through Europe. Here in Nepal, we see levels that are much higher, levels that we just don't ever see in the United States or in most Western countries. The population here in Nepal is exposed to this nearly year-round. The levels are quite amazing.
We are working with the traffic police because we want to find some population who are the most vulnerable and who get the highest exposure from the air pollution, and so they would be the perfect person for studying the health effects of the air pollution.
There are no traditional traffic lights that we're used to in Western nations. They rely on human personnel to direct some of the chaos in traffic through the Kathmandu streets. We measure a variety of health endpoints, including lung function and blood and urine collection and blood pressure, as well as electrocardiography. At the same time, we're measuring some very high-end research-grade measures of air pollution to articulate some of the most relevant findings on why air pollution affects human health. This project is designed in two phases. The first phase was conducted in January and February and March of 2014 during what's called the dry season, the season where regional pollution levels are high everywhere at all times. And we're wrapping this second phase up and should be done shortly in the rainy season, in the monsoon season, and has a net effect where it reduces regional air pollution to near background levels. So we can now study the same population of traffic police where we remove the background levels of air pollution, but they're still enduring very high levels of traffic-related exposures.
There are a lot of people and increasing number of vehicles. Often poorly maintained and older vehicles are driven on the road. That is why there is so much air pollution in Kathmandu.
I am feeling very happy to participate in this study because I got the opportunity to learn new things about health effects of air pollution.
The University of Massachusetts is the principal investigator, and we work with a group called ISIMOD, which is based here in Kathmandu, as well as partners at IASS Potsdam and Nepal Health Research Council, as well as some investigators at Tribhuvan University.
I wanted to do and I wanted to contribute to the country, contribute to the science, and make the life of people better.
We'll take the results from this research, and our expectation is to both publish this in peer-reviewed scientific journals, but also do quite a bit of outreach within Nepal and the broader scientific community itself. And we can begin to reduce some of this mortality and morbidity that is so endemic in these developing nations, nations that just don't have the resources to deal with many of these issues.